Okay, let's talk about cell population data, the need to have automated leukocyte morphology. Lately, in company Man Ray has been several developments that has been introducing new concepts in hematology. One of them was the SF cube. The SF cube is the first multidimensional analysis of the cells using not only the forward scatter, the side scatter, also the fluorescence that measures the size, basically measures the size of the nucleus. That is very important because, as you know, one of the criteria for malignant cells is the relationship between the cell size and the nuclear size. For this reason, being practical, when I explain cell fluorescence is the size of the nucleus. Also, in addition to that, lately has been developed the multi-layer fusion technology for imaging, the MC80. And I will mention after several aspects that makes this technology unique. But also the more important thing is the same company have both technologies in the same automation line. Last but not least is the introduction of artificial intelligence. Artificial intelligence not to replace us, but to help us. To help us having a better detection of malignant cells, of blast. As we will see, the results are amazing. You can see here in this center slide is doing a multi-layer focusing with immersion oil. That is the only technology that uses immersion oil in 100 plus objective to do a perfect visualization of the cells, able to do diagnosis. Before that, many of the users were having to look for the smear to see if they are blast, in which type. Yeah, you can do it for screening, but for the diagnosis, they were going to the microscope. Here is not anymore necessary because you have a 100 plus immersion oil objective. The best of in this moment for Man Ray, because one of the things I like that now I collaborate as a scientific and medical affairs responsible for Man Ray, is the continuous improvement. In the last months, we have seen the presence of the concentrated reagent delivery system that avoids to bring for the medical technologies and the nurses the weighty containers of the sample processor. That is very important because, as we have seen, many of the parameters are affected by the temperature, and this sample processor will keep the samples at the good temperature to be able to reanalyze with very similar results after several hours. Of course, the instruments, the CBC, retic, platelet, optical platelets, and IPF, the BC6800 or BC6200, the new instrument that measures erythrocyte sedimentation rate, CRP and serum amyloid, both all of them inflammatory and infection markers that are very useful, and you can do all in one test, in one tube. The auto slide, the slide maker, the SC120, the digital cell morphology instrument that read the smears and is able to show us the high quality images, and last but not least, the hemoglobin A1C for diabetes diagnosis. Let's go for the one by one for these instruments. The BC6200 or BC6800 are able to do the SF cube and to give us the best flagging for malignant cells, as we will see in some of the studies that have done recently. The Man Ray SC100 is automating the slide smear with a very unique sapphire slide that permits to keep the quality of the slides for a long time without any breaking of the instrument. And finally, you can see the quality of the cells, and it's the only one with 100 plus immersion oil objective. But we have, and now it comes my talk, we have MCV, RDW for red cells. We have MPV, PDW, and IPF for platelets. But why we don't have any cell morphology parameter for the leukocytes when they are so important? And that was the focus of my career from 1999, in that I published a poster in the ASH about how to use the cell population data for the improvement of the laboratory hematology diagnosis. And this is the important thing to know. These are lymphocytes, but how different they are. Will be important to know the size of the nucleus. Will be important to know the size of the cell, because these nucleus are very similar. The plasma cell leukemia and the CLL, but the cytoplasm is absolutely different. One is very small, and we can see that combining the cellular size and the nuclear size. And if we can use that and combine them, why don't we use it? Neutrophils, again. These cells are one hypogranular neutrophil, one normogranular neutrophil. Will be nice to know that there are some neutrophils that are hypogranular. And what happens when they are very big? The size of the neutrophils, and then if they are segmented. Neutrophil X is useful to detect hypogranular cells, and neutrophil X also, when it's very high, toxic granulation or hypersegmentation. The same for the monocytes. Don't forget the monocytes. I did one study that we will see afterwards, how the monocyte size can predict the cytokine storm in the COVID patients, but also in the dengue patients that become hemorrhagic fever. Also the Ebola or other hemorrhagic fevers, before to enter in this pathway of the hemorrhagic fever, of the severe and deadly situation, monocyte size goes high. Cell population data. Here we have these parameters that comes out of the normal CBC, and the first publication I did myself in 2000 in blood, and the first patent was about malaria in 2007. And these are the cell population data from MindRay. This was a study done to see the reference values of these parameters. I have to say that we are in the process to get calibration and control materials to everybody can have the same results in the world. For the moment, everybody has to calibrate and to know its own reference values. There is something very useful that I will say is export your database, select normals, numerically normals and non-flags, and getting the average of these cell PD, cell population data of these normals, you will be able to monitor if your reference values are stable in the time. This is now coming much more, the resolution of the projector is not so good, but you will maybe see. These are the neutrophil, the monocytes, and the lymphocyte cell population data, and this is ALL, AML, CLL, sepsis, viral infections. What I want you to see here is a potpourri of viral infections, sepsis, AML, mantle cell lymphoma, multiple myeloma. Look, the parameters, cell population data, when they are high, they are red. When they are very high, are bold red. When they are low, is blue. When they are very low, are bold blue. All the patterns for all the diseases are different. Combining them and using artificial intelligence or using rules, we can help to suspect hematological disorders. This study was done by Dr. Sabrina Boro in Italy. There are many posters now and many investigations running. I will only collect the ones presented in the ISLH 2022 in Bologna. In that were presented from MindRay 35 posters from customers about IPF, about sepsis, about cell population data, about blast detection, AML, dengue, etc. This is one of the images of the Congress. In this Congress were presented applications of cell population data for anemia. Leukocytes for anemia, yes. This study was done by Stefania Landucci from Rome about how to detect myelodysplastic syndromes with the automated parameters, with the CBC. And he was demonstrating that the use of neutrophil scatter was very useful with a ROC curve of 0.858, sensitivity of 95%, detecting dysplastic neutrophils, degranulated neutrophils, and detecting, suspecting myelodysplastic syndromes. This is amazing, and it's for free. It's included in the 6,800, and maybe one of these days, Shama will give the good news that other instruments will incorporate to cell population data. Another of the studies was done in anemia, was done by one of the doctors presented here, Dr. Hiren Danani, that we did this investigation together, in that he demonstrated that in megaloblastic anemia, not only the microcyte count, that was very good also, but the monocyte fluorescence, the monocyte size, and the neutrophil scatter were very good for detecting megaloblastic anemia. And this is very important because 50% of the megaloblastic anemias, if we do in a random series of 500, 1,000 anemias, random, we do B12, we will find that half of them have normal MCV. And the problem is the GPs don't order B12 if the MCV is normal. For this reason, this is really an issue. And using the free, no charge, cell population data, we can have a flag and suspect and order B12 deficiency when the MCV is normal, there is an anemia, but the neutrophil size, the monocyte size is high, neutrophil macrocytosis, monocyte macrocytosis, we can suspect megaloblastic anemia. The neutrophil X shows hypersegmentation that also helps in addition to suspect megaloblastic anemia. Applications of cell population data for sepsis. There were two studies, one that is now an article, the poster was presented also in Bologna, I will present the article, not the poster, in that they were saying that monocyte X and neutrophil monocyte scatter and neutrophil fluorescence having a ROC curve more than 0.7 were very useful to suspect sepsis. But look, they were checking also procalcitonin, and procalcitonin was lower efficiency, area under the curve, 0.65, lower than the cell population data. And cell population data is for free in the people that have the 6,800. Please don't forget the hematological parameters. Also was presented another poster about how to automate the detection of sepsis by Italy. In that, they were using the neutrophil X, the neutrophil scatter, that shows the hypergranularity, and the neutrophil complexity, the neutrophil fluorescence, that is correlated with the size of the nucleus. Metamyelocytes have higher nucleus than segment. Myelocytes even higher, and promyelocytes even higher, with an area under the curve of 0.935. And the monocyte X, 0.855. This is amazing, and only with parameters that are incorporated in the instrument for free. Last but not least, this is not cell population data, but is using also the position of the cells. It was a very nice study comparing. It was a ROC curve showing better performance detecting cancer cells in body fluids of the MindRay 6800 compared with the 6-MEC6N. For this reason, we are using also the morphology of the cells in the plots, in the scatter plots, to measure and detect better cancer cells. This is a study I did myself in collaboration with Wuhan, as a hospital in the beginning of the COVID infection, analyzing 447 samples from 92 patients of COVID. In this case, for me, it was good also to assess if they have severe COVID or mild COVID. But the more important was to predict, because I am focused in the clinical application of the parameters. And I was interested in to predict which patients will go bad, which patients will go good. And I detected that the monocytes were higher, the group 5, before the cytokine storm. And that was very useful. And I will show you the group 5 is 1 day before the cytokine storm, 1 day before the patient became severe. What was happening? The monocyte size that was constantly normal, it increased and after became normal. As you can see here, the monocyte Z, the monocyte size was followed and become bigger and after lower. And that you can see the photos of the monocytes. But so the monocyte size is a good predictive value of a cytokine storm in sepsis and in COVID. Similar approach can be used for dengue. Application of cell population data and artificial intelligence for the detection of malignant cells. The malignant detection can be in the instrument by the flags, And it was an article published also in Bologna that's applying a rule. Without the rule, the sensitivity was 97% for blast, the best from all the other companies if you see any study in the sensitivity of blast. But we were using the cell population data and the cells and the CBC parameters. If leukocytes more than 16,000, neutrophils more than 15,000, hematograms more than 27, and neutrophil fluorescence more than 470, suspect promyelocytes blast. And with that, the sensitivity became 100% with only 2 more false positive. For the reason cell population data can be used to tailor our sensitivity for any disease. But after we have the malignant detection with MC80, and MC80 have also cell population data, and we can manage in MindRay this information to improve the whole automation line sensitivity for malignant cells. The CBC cell population data and the stained cells cell population data. And in this article, it was shown that the correlation of the MC80 blast with the pathologist was 0.985, but the cell vision have 0.883, higher than one of the leaders in the market of digital imaging. Why? Because it's using the 100 plus immersion oil, and the other is not using immersion oil. The quality of the image is much better to get much better information about the cells. Here we can see the sensitivity for the different abnormal cells that was 93%, 95%, 94%. And this is the technology is using to do this job. We can see an example of blast cells, how they can be seen in the MC80. Dozens of new parameters for cell diagnosis that are, together with cell population data, improving. But now we have the color and the texture of the nucleus and the color and the granulation of the cytoplasm. And now we have this combination of information to improve the diagnosis. Also, we can have red cells, but this has been shown, I will not enter on that, an image of the red cells and the platelets. But the instrument is detecting, pre-classifying the schistocytes, the target cells, etc. One clinical case only, that I always use this clinical case because I'm reminding everybody the typical pattern for a population in the myeloid, monocytoid area with 19,000 leukocytes, with 89 platelets, 89,000, not a lot, not very low, and as you will see, abnormal promyelocytes. Look the quality of the cells in the MC80. Acute promyelocytic leukemia. By conclusion, the highest sensitivity for the detection of hematology malignancies thanks to the use of cell population data automatically, or we can create even more rules to even improve the detection. We can tailor the sensitivity we want in our lab. The highest throughput and highest sensitivity for the detection of hematology using digital imaging. For the moment, we cannot dispose these parameters, but MindRay is trying to get also the highest sensitivity in digital imaging. This is a lymphocyte from a teenage lady that was having her first relationship, and of course, she got, in this case, an Epstein-Barr virus, and this is an infectious mononucleosis, really, from digital imaging. Thank you very much.
Very interesting talk and nice presentation. And I love this last slide the most. Any question for Dr. Simon?
Very nice. Dr. Ramon, always a pleasure to listen to you. This talk has highlighted the importance of early submission of the sample to the machine, because the changes of morphology we know occur within 3 to 4 hours. And we have seen such weird looking mononuclear cells. And I think we must realize, to get a good cell population data, we have to submit the sample to the machine as early as possible.
Yeah.
And I think the main important thing is, maybe we say 6 hours, but I think nothing beyond 2 hours will be good for a good cell population data. I don't know what is your cutoff. Normally we say make a smear within an hour after collection of a sample in the EDTA.
Yesterday evening, I was going to the bed a little late because I was doing precisely this study from a doctor from Italy. Yeah. She is presenting, Dr. Rolla, an article on sepsis, and the peer review asked, what is the stability of these parameters? Right. And we were analyzing the stability of these parameters at room temperature and at 4 degrees. The thing is, at 4 degrees, you have to keep at 4 degrees when you have to analyze more than 6 hours.
6 hours.
Before is better at room temperature. Okay. But one condition, if you keep the samples cold, you have to analyze the samples cold. For this reason, this is an important point. If the cells are after 12 hours, after 18 hours, for any reason, the sample arrived from an external lab. Yeah. If you have to analyze it, keep attention, don't wait that the sample get room temperature. Analyze the sample cold.
Cold, yeah.
Yes, when this article from Dr. Rolla will be published, you will see the data of the stability of cell PD that is mandatory for every study, every publication you do. Thank you for your comment.
No, it's absolutely necessary because we are looking at the morphology of a cell. Yeah. Basically, machine is also looking at that. So.
Yeah, and the neutrophils have a medium life of 6 hours.
Yes.
And after that, they change the morphology for sure.
Totally. Thank you.
You're welcome. That people hate errors. I love errors. Okay. Because I love errors because I collect them and I analyze them and I check for the cell population data and I use them to continuous improvement. Every month, every 2 months, I like to collect all these errors and to try to find a way to avoid that they happen again, to get the Six Sigma. For the reason, I love errors and I encourage the people to bring me the errors. Don't hide the error like nobody see me. No, love the errors because the errors will improve your laboratory practice in the time.
Thank you, sir.